All right, today we have Ronnie here. He is a 53-year-old male. He is 2 days post right ankle sprain. The phase of healing that he's in would be the inflammatory response phase, which usually lasts between 0 and 6 days. So since he's on day 2, that's most likely the phase he's in. This phase of healing is characterized for him by the bruising, swelling, and tenderness around the injury that he has. Um, the indications for ultrasound in this case, specifically non-thermal since he's in the acute inflammatory phase of healing, would be to stimulate the healing process, increase protein synthesis, increase fibroblast activity, cell permeability, and tissue regeneration. Some contraindications for ultrasound could be any implanted electrical devices, active infection, hemorrhaging around the area, impaired mentation, pregnancy, active cancer, or deep vein thrombosis. This patient does have a history of heart, coronary artery disease, and type 2 diabetes, but these factors shouldn't make ultrasound dangerous for the patient, so it should be still good to use. Um, so first, I'm going to inspect the area of skin, make sure that it's okay to use ultrasound on it. All right, Ronnie, so we've got your right ankle here. Just kind of take a look at the area. Skin looks okay. So, have you had ultrasound done before? No. Okay, so it's basically this machine is gonna emit sound waves from this head here. It's gonna send sound waves into your ankle. We're gonna put some gel on your ankle also to just help those conduct better and make sure that we don't get any burning on your skin and make sure that the crystal that's inside this head doesn't break. Do you have any concerns about ultrasound, or do you feel good about doing it?
Just want to get my ankle better.
Yeah, that makes sense. And do you have any history of cancer or any of the contraindications I listed earlier, like deep vein thrombosis? Okay. And saw that the site was not infected. And do you have any implanted medical devices? No? Okay. Alright. So for the settings, we're going to use 20% duty cycle so that we're getting a non-thermal ultrasound treatment. We're going to set the frequency to 3 megahertz because it's more of a superficial injury. The ankle structures that were involved are not very deep. And then we'll set the intensity to 1.5 watts per centimeter squared. And the ERA for the ultrasound is a little bit smaller than this head, and we're going to treat about 2 to 3 times the size of the ERA on his ankle.
Deep lunge. So you're sliding.
Alright, Ronnie, I'm going to actually have you roll over onto your left side. So you have to Does that feel comfortable, or would you like another pillow? I'm gonna go ahead and put some gel on your ankle.
I'll just say that. You're supposed to use thermite, so obviously have her pass
And I'm gonna make sure to make contact between the ultrasound head and the ankle before starting the machine. That way we don't break the crystal inside the ultrasound head.
start it though, we're gonna put some ultrasound on and you guys have it moving so that we don't damage the crystal. Sorry, this might be a little cold.
You guys just wanna like just hold this
So
on my
sorry.
face. Don't let go.
I'll do it, but can you answer a question?
We'll move you around.
Okay. So now that it's been about 10 minutes, we're done with the treatment. And while I was doing the ultrasound, is making sure to move the head around to different spots and move it at a speed where we don't get any burning of the tissue. Because if you leave it in one place for too long, that can happen. And I'm gonna go ahead and clean off Ronnie here. Alright, Ronnie, how are you feeling after that treatment?
Felt good.
Felt good. Okay, I'm gonna just take another look at the skin, make sure it's okay. Yeah, it looks, you didn't get any burns or anything. That's good.
How are you feeling?
Alright, and that concludes our ultrasound treatment.